Welcome to Doing Business with a Servant's Heart. Doing business and life with a purpose, serving others and achieving success. I'm your host, Steve Ramona. We created this show for you because we want everyone to learn how to do business and life to make an impact in the world. What impact will you make today? Welcome to my guest, Christopher. Welcome.
Thanks. Appreciate you having me.
We have a very unique business and way you serve, but I want to talk about formal education. How valuable and important is that for people listening?
I think if it's technical in nature, sometimes very valuable. If it's not, particularly these days, maybe not so much. So I think what we're learning now, well, to back up just a step, I didn't learn anything until I was in graduate school. That's where my focus was. I got a master's in healthcare administration. So that really taught me a lot about the field I was going into. Prior to that, it was 4 years of the general education stuff that just didn't do a lot for me. And what I think we're seeing now is that with the advent of online learning in so many ways, people are pursuing things that are deeply appealing to them and not necessarily the general things. If you're not interested in reading Shakespeare, why, how far do you need to go before you realize that's not your thing? So I think we're on the precipice of a lot of changes in formal education.
Yeah, it's interesting. Education comes from experience as well. How important is that in your eyes?
That's super, super important. I think you get some of the basics in school, and then from there it's all experience. I mean, that's where all your learning really comes from, the mistakes you make, and I just can't stress that enough.
With the education, whether it's experience or formal, what does real support look like in life?
And it really comes down to people. I mean, if you boil it down to its basics, it comes down to the people around you who either support you in terms of being a great advisor, listener, supporter, or they support you in terms of taking things that they're going to be far better at than you are. So in Strategic Coach, they have a book and a whole concept around who, not how, and I'm a member of that. But that is the idea that if there's somebody that's so much stronger than you in an area, why not give them that piece? So that's a supporter, and I really think leveraging that is the key for any entrepreneur anywhere to continue to grow, because you can grind it out for a while, but eventually you've got to put people in place who can really support those foundations, and they love it and they're stronger than you.
And my dad used to say, never recreate the wheel. Bring people
Yeah.
in, create your wheel for you. And
Yep.
Steve and Christopher are pretty happy. But it's interesting with support. The other aspect of it is a mentor. I have
Yep.
mentors. I'm sure you have mentors. How important is that in your eyes?
You know, I think they have mentors over the years have been important in different facets. I've never really had a long-term mentor.
Mhm.
I've had some coaches in some various areas where I felt like I got really strong, and maybe I moved on. And it's funny in asking that, I think there could be some mistakes in some of that, and maybe I've left behind some mentor relationships. But I think it's important to have people to pass on wisdom and guidance in any walk of life. One of the things that I see as an entrepreneur looking backwards, I see all these, what I say, or what I call, are budding entrepreneurs. I'll kind of stumble upon them, and you'll see it's somebody out there with their own thing and they're really hustling. And it's so easy for us, and Steve, you included, I think, to see, hey, I've got a pretty clear idea of where you're trying to head, and there's going to be challenges in your path, and those are things that you can deal with. But without the experience of having dealt with them, it's probably all just stress and anxiety. So that's a really interesting place to be.
Yeah, the stress and anxiety is no help. And I always tell people entrepreneurship is not a solo flight. You may be
Yeah,
an
not at
entrepreneur,
all.
solo, right? Not a big fan of solopreneur. I know people use it, but it's not a solo, and it shouldn't be. That is what you're saying.
Yep.
And that's interesting. And your business is with EMS, ambulance, you do billing, third party, which I love because I know
Right.
healthcare is a mess. But why'd you go that route when it comes to your business?
You know, I very quickly realized that my childhood dream of being a doctor wasn't going to happen. I didn't have the science in me that I would need. And I'm really grateful that it didn't happen because it introduced me to the whole business side of healthcare. So you have the whole side of paying providers and supplies and getting reimbursed and patients and all that, and it's a bit of a mess. However, there is the opportunity to do some good there, and that's what always spoke to me is how people are touched by healthcare, whether it be scheduled or even wonderful having children, things like that, or unfortunately, emergency medicine. And in my career, that was always my connection. Not being clinical myself in any way, that connection to the people. And as I progressed in my career, I saw that not the connection, but the opportunity to do better in terms of helping providers who are in emergency care. And so it just led me down that path. And then I started working with fire and EMS, and they're people who do things most of us can't imagine. And I saw the opportunity to serve them as best that I possibly could. And then as I founded my first company, as best as it could. And it's really, I mean, it's the most needed of care, kind of all of the things being equal. If you're in need of an emergency care, everybody understands that. And we all have some expectation that it's going to just happen, and it does. But they have their own whole piece of it related to the trauma of the job and the PTSD from what they go through. And then on the back end, there's this business piece of it that's also supposed to be handled and managed. And they just need help there. They need somebody else to help them work through that and to understand it. And that's really rewarding to be able to do that piece of it.
That falls back to support what you were talking about. You're supporting these, they're great
Yep.
emergency services, but not
Yes.
so great at business, which a lot of people, solopreneurs, entrepreneurs do. They've got a great desire, passion, and idea, and they
Right.
just don't want to follow through on it.
Right.
Yeah, this is going to be a comment. Healthcare needs help.
Right.
What's one of the things that you see besides what you're doing in such a great way that the healthcare can be helped?
I think there's a few things. One, there's a shortage of providers in all walks of life. So for us specifically, paramedic, EMT, those are things that and careers that a couple things need to happen, in my opinion. A, we need more of them. So you need kids coming out of school who maybe recognize that going into the liberal arts college is just not the thing for them. They're not there, and they don't necessarily want to pursue other aspects of healthcare, but they really have an interest in working in emergency medicine. It's a bit of an adrenaline driver for a lot of people. I think most everybody I've ever met is pretty type A and pretty hard charging, and that's a good thing, but there need to be more of them. The other, probably the second piece of that, just in our own little world, is they are woefully underpaid. It's all woefully underfunded in terms of what happens out there in the field. So we rely on them in times of crisis and need and all these different things. And then on the flip side, you have them paid, I think, generally along the lines of maybe a school teacher. And that's okay. I think school teachers do a great job as well. I'd probably argue that they're underpaid as well.
Yeah.
But there's so much money in our healthcare system. I think on the one hand, without addressing access to care generally, there needs to be a real reckoning of the reimbursement side of it and paying people that can pursue this as a career, a well-paying career that we all rely on. I think it's a real oversight in our
Yeah.
country.
No, and I like that career. It doesn't help emergency services. Somebody jumps in for a couple of years and then becomes a doctor or a
Yep.
teacher.
Yep.
It's not a fit because now you got
Yep.
people coming in and out. The people thing probably can be handled better, more easily, right? But the money thing is always a problem in everything, but especially this. I don't know the answer to that. What do you think the future of emergency services looks like?
What I think is going to happen is there's, like so much of our healthcare system, it's very focused on treating you after something's been uncovered. It's not preventative in nature, and it's really not preventative in nature because the reimbursement has always followed the treatment. So more patients at the hospital is better reimbursement for the hospital, and those things are starting to change. And in EMS, it's not that different. Transporting a patient at the hospital is how you get reimbursed. But we saw during COVID, and we've seen for a while now, but certainly during COVID, people were really scared. They may have had something going on, but they didn't want to go to the hospital. And so that continues to open up these avenues of maybe somebody responding directly to you, making sure you're stable, making sure you're okay, and that sort of treatment without needing to take you to the hospital because you don't need to go, all under medical direction. But those are not structured reimbursements at the moment. And we're going to have to get to that point because, it's funny, our whole economy, Amazon and Uber Eats and all that is right to the person, just in time, right to you, your package, whatever. And we're getting used to that as a people. And EMS is probably not that different. You have a capacity issue, but because somebody maybe has something that's scary that's going on, doesn't mean that they need to go to the hospital necessarily. And if they don't need to go, then how does that provider get reimbursed? Because they did the work, and they do need to get reimbursed, and reimbursement is already pretty pathetic. So you add that no reimbursement on there. That doesn't help the picture. So I think we're going to slowly catch up with the idea of kind of seeing people where they are as an extension outside of physicians' offices and hospitals and things.
Sounds like overuse has been a problem since COVID, meaning people are calling for ambulances when they really don't need them. Is that what I'm hearing?
Not necessarily.
Okay.
So what I mean by that is COVID was interesting because people were very scared to go to the hospital
Oh,
in many instances. So you would have, I had something similar myself with COVID. You have some really scary symptoms going on, but you're really not sure that the hospital is the best place for you to go. Certainly in the early stages of COVID. So there was a lot of that. There was a whole lot of people calling 911 and then really not wanting to go to the hospital. And to some degree, they were better. I mean, paramedic or EMT was there and they treated them, and so they were better. And then didn't see the need to go to the hospital. That's not that atypical from any other EMS system at any time. You have refusals, you have all these things. But COVID was interesting because you kind of had a mass concern about, if I go to the hospital, am I going to put myself at greater risk or not?
so you're taking the resources of the paramedics coming and treating people at the home,
Yes.
not, and then there's a financial situation. They don't take them back to the hospital because they say no. That's causing some impact on the whole system.
Yes. Yeah.
Wow.
And EMS already has that. EMS, um, they transport, they treat, they do all these wonderful things. So the need and the demand and the healthcare, the integrated healthcare system, it all exists. What I think the missing part is that EMS needs to be compensated on the way on the level of driving more people into the field, and they're just really really not. And so you're adding stress to a system that we all rely on. And COVID was interesting because you saw, EMS responded, fire still responded, they were still there. There was no significant breakdown in those systems, even though they themselves were challenged, as we all were.
Serving, doing business, servant's heart. You talked about it many times, how you serve. How, it's just a question that came to my head. I'm a paramedic. I get to a home. You've got a patient that's fighting with you and you're trying to serve them. How they, I don't know if you have an answer to this, but are they taught how to handle? Is there a way to handle that so they're still serving? Because it's such a touchy situation, I would assume.
Yes. And so my experience has been kind of third hand. So I've done some ride outs with fire and EMS. I've kind of seen what they do. They are very well trained. And it's interesting. They're trained from several aspects. One is they're trained on the clinical patient care. They're trained on kind of management of the scene. So you can imagine if you have a big mass casualty, let's call it a bus wreck, and you have multiple helicopters landing and ambulances. So not only is it patient care, but there's scene management. And then on the back side of that, you have the people who've dealt with all this and the support systems to try to help them overcome some of the associated trauma with going through it. And what I saw that really, really drove me to continue to want to do my best and for Emergicon to do its best for them is even if it wasn't something that clinically maybe was a big deal to a patient. So I mentioned to somebody recently that I went on a ride out on an ambulance, older couple still living on their own. The husband, who he had to be 80, had cut himself kind of superficially, but he's bleeding a lot, and the adult children were there. So I was just a rider. We showed up, and the crew treated him compassionately, took care of him, and I think they transported him, but they treated him and the family as if this was something not to be concerned about, but that they took seriously, even though even in my naive view, it wasn't all that big of a thing, but the family's concerned. It's the father. And that to me is fascinating to be able to keep that same kind of, say, bedside manner or cot-side manner when it's not a gunshot wound or it's not a massive, multi breaks type of I'm trying to think multi systems trauma type of thing. It's more of a superficial thing, but the family sees it as serious. So all kinds of fascinating things happen, and you have people who well trained, but probably have to deal with things that maybe they've never been exposed to before, and then they've got to kind of lean on each other, I think, to get some advice and counsel.
Thank you for answering that. That's really good because I figured they were, but again, they're like teachers and they're not getting paid enough. I mean, you
Yep.
couldn't pay me to do it, to be honest. That's not wrong, wrong with me. No,
Yeah,
it takes, like you said, a type A person. It's
it
nothing to do
does.
with me. But people out there, if you're listening, please reach out to Christopher or reach out to your local. How could they, who would they reach out to if they want to get involved with the EMS?
I'll tell you quite honestly, and it's interesting, all the years that I've been doing this, so often people never really think about this whole system that operates. So in the state of Texas, there's an entire coordination of trauma response, regardless of what it is, and it's very well done. There's a governor's task force that brings together some of the players to agree to certain, things as there's debate and structure. But generally people, it's one of those things we don't think about. It's in the background. We don't think about, at 3 o'clock in the morning, what they're doing while we're sleeping. So my number one advice, I think, for people is just to have an understanding of who serves your local community, who serves where you work. Is it the city fire department? Is it a county service? Is it a private provider? So get an understanding of who serves your local community. Do they have needs? Is it a local thing and they're trying to continue to raise funds? They've got, I mean, there's all kinds of things. There's we donate to different services from time to time. Sometimes it's water, so bottled water. So you can imagine firefighters and paramedics and all on a scene of a house fire. There's patients and all that. They go through a lot of water. They're exposed to a lot of heat. So there's generally needs. So I think the first thing is to understand who serves in your community, and is there something that they need that you might be able to help them with. And then from there, maybe a little bit broader, just a general understanding of, if you have to be transported in the back of an ambulance, what are your local hospitals like? If you're in an urban area, it's pretty well designated, but if you're in a rural area, you may be further than you realize. And it might be somewhat important for you to know what that looks like, and maybe your family to understand what that looks like if you're some distance from the hospital and maybe some distance from responding EMS. So I think just general awareness of the way that this system is built to help you in your time of need is not a bad thing, because at the moment you do need it, it is certainly not circumstances where you're going to be really thinking clearly, more than likely.
Right. And you need a village. And I love hearing about systems infrastructure because
Yeah.
it's such a complicated thing. I can imagine. We're running out of time here, but I always like to ask the guest, what does a servant leader look like to you?
For me, it extends to not only who we serve professionally, but our teams as well. I've always really been passionate about the people that choose to work with us. So I mean, literally, the employees and managers and leaders who choose to come and work with us. Certainly, they have choices. You can choose to work all kinds of places. And I think it's important for anybody who's in a leadership seat to think about those teams that you're working with and to think about them not only as people, but as professionals. As people, we have all kinds of things that are going on. And sometimes those aren't great and there needs to be understanding. Sometimes those are great. There needs to be celebration. But it's important to, have the level of professionalism among teams and all that. But it's also important to avoid bureaucracy and just be people together a lot of times and let people know, where they shine, where you can help them, all those things. I won't say it's easier. It just seems really clear for us when we serve the type of clients that we do in fire and EMS. They deal with things we can't imagine. So we tend to be very grateful and very understanding of how we can be helpful to not create a problem for them where we can avoid it, or certainly their patients.
I definitely won't put servant leader and bureaucracy together. You're absolutely right. They're not yin and yang with those two.
Not at all.
You have no
Not
bureaucracy.
at all.
Well, Christopher, I want to thank you. I've learned a lot about EMS, emergency services. God bless you for what you're doing. I know
Thank you
you're
so
to your
much.
business, but it's a servant business, and there's always value to that. You're helping the emergency services. And do you work across the country with all the different
We work
services?
just we work just in the state of Texas.
Just stay
We
tech.
we consider others, but we work just in the state of Texas.
So everybody in Texas, you're being well taken care of by Christopher. Let's just say that.
Thank you.
And thank you, everybody, for listening. Re-listen to this again. I always say that. You'll get more tidbits from Christopher. And, if you want to become an EMS, paramedic, firefighter, all that, as he said, they're lacking in people. Reach out to your local area and find out how you can, become an EMS and maybe work with somebody like Christopher down the road. And we'll see all of you at the next episode of Doing Business with the Servant's Heart. Thank you.